Wayne lives in Malta. When he was a boy, he had a dream.
I grew up loving cars, and one of the things I always wanted to was to work something I love. But unfortunately, due to my skin condition, to my eczema, due to the dust or the things that you do, they're all very messy, and it's very easy to get infections or things like this. So that was something that I had to give up on very quickly. It can come out from
Wayne was diagnosed with severe eczema when he was 4. Problems soon piled up.
When I went to do my first passport, at that point I was quite young, and my photo I had here, it was completely broken, sort of. I was like a mini Joker to a certain extent, and I had a lot of flare-ups around my eyes, like even a cracked eyelid. My ears would be very puffy and red, and they obviously wouldn't want to take a photo due to identification reasons, and even for me. This is a disease that affects the skin, like our biggest organ. I've had days where I couldn't even move my neck around. I've had days where, for me to get off a chair, I would want to cry. I have days where my clothes are stuck to my skin due to open wounds.
A cocktail of medicines now keeps the disease at bay, but periodically they cause side effects like nausea and high blood pressure. When Wayne stops his treatment, his body flares up again. Yet the injectable prescription medication that doctors think would be the most efficient for him isn't available in Malta.
At that point, I wish to know why I have to wait so long for something that I need so badly.
The medicine's already been approved by Malta's regulators and is eligible for free administration, yet it's nowhere to be found in the country's pharmacies, unlike in those of other EU member states. His dermatologist says the consequences are dire for Wayne and other severe eczema patients.
The fact that these drugs are not available means that patients will have to be treated with other drugs which are less effective and perhaps have risks of important side effects which could be avoided by using the better drugs. Patients should certainly not be discriminated against because of the disease they are unlucky enough to have.
Red tape, Brexit, COVID, the global supply crisis and the war in Ukraine help explain the situation. But Malta also has a structural problem, its tiny size. As the EU's smallest member state, the country appears to be less attractive to pharmaceutical developers. This warehouse stocks all the medicines used by Malta's social security. It looks packed, but statistically, Malta lags behind other member states when it comes to full public availability of approved medicines, with numbers well below Germany and the European average. The man in charge of Malta's medicine supply unit says they're working flat out to find solutions.
If there are high numbers, the industry registers the products and we have no problem. But where there are few patients, and Malta, obviously, it's a small country, so you get these treatments where few patients need them. Then the government comes in for registration. We do the translation, we do the serialization.
To further help small countries like Malta, the European Commission's reform of EU pharmaceutical legislation proposes to reward developers who launch a medicine in all member states within 2 years of authorization. According to the EC, this alone would increase access by 15%. Further proposals, such as a simplification of authorization procedures and the introduction of multi-country packages, have been welcomed by Malta's pharmaceutical industry.
The pharma industry, in its best of efforts, needs to try and make the product a bit more affordable for the smaller countries. We need to see stocks, depots of drugs available for the small countries. And the multilingual pack could possibly help that, because you've got a depot which will serve 6 or 7 or 8 countries when needed.
Wayne hopes that all actors will soon be working together to help him.
I do believe we will get there, if especially what is necessary is done and the people help each other out.